Welcome, and thank you for joining us for our How Lupus Affects African American and the BIPOC Communities. This is a virtual symposium sponsored by GlaxoSmithKline, and my name is Anita Love. And I am a 30-plus year lupus advocate and member of the board of More Than Lupus. If you are unfamiliar with More Than Lupus, I want you to know that we are a multi-ethnic, multi-generational, and international lupus community designed by lupus patients to connect, grow, and improve each other throughout the peaks and the valleys of our lupus journey. We believe that every person who is a lupus patient deserves respect, honesty, and good communication with their provider. At More Than Lupus, we not only encourage and support one another, but we also, if need be, go to doctor appointments with that particular patient. Today's event is our undertaking and our first installment in our Lupus in Minorities series. They will be followed by 2 other symposiums and the ethnic community. If you are unfamiliar with lupus, we say to you, stay tuned. You'll want to hear what our speaker has to say today. Today, we will be focusing on how lupus affects the heart, particularly in African American communities. We will have with us a cardiac thoracic surgeon who understands how lupus affects the heart. Again, I encourage you to stay tuned and listen to what the physician has to say. And now I would like to introduce to you Dr. Stephen Leonard Noble, a cardiac thoracic surgeon who just happens to be my son. Thank you, Stephen, and welcome.
Thank you, Mom. And it's a pleasure to be here. It's a pleasure to be here with More Than Lupus, a great organization, to talk about lupus and in particular heart disease. I think that when we think about lupus, which is an autoimmune disease, how I explain it to patients is that it's as if your body is fighting itself. And because of that, oftentimes it's difficult for patients to get diagnosed as to having lupus and eventually treated. Some of the things that we do know about lupus is that it affects several organ systems within our bodies. And in particular, we're going to talk about the cardiovascular system, or the heart, as well as the arteries of the system or of our body. So lupus can affect pretty much every major organ system. And although it does affect cardiovascular system, we need to keep in mind that the number one killers of Americans, regardless if they have lupus or not, is cardiovascular disease. And so individuals with lupus are still at great risk for that. As we talk about Black Americans in regards to lupus, it's important to know that we as Black Americans are 24% more likely to die from heart disease than our non-Hispanic whites. In addition, we're 20% more likely to have high blood pressure, and it's that high blood pressure that can lead to some pretty significant effects. As it relates to women, Black women with lupus, they are 60% more likely to have high blood pressure, and Black women ages 20 or older can be nearly 59% of them can have cardiovascular disease. So at baseline, even without lupus, cardiovascular disease, especially in Black Americans and in particular Black women, is a disease that really we need to focus upon and always take note that this is devastating. As it relates to lupus and some of those conditions of the heart that it can affect, one of the main ones is hypertension or high blood pressure. 50% of people with lupus experience high blood pressure, and that is defined as having a blood pressure greater than 140, the top number, your systolic number. So when you go to the doctor and there's 2 numbers that you should hear, there would be one number over another number. So that first number is 140. If your blood pressure is over 140, that signifies that you do have a high blood pressure. And if the bottom number, the diastolic number, is over the 90, that signifies you have high blood pressure. In addition to that, many more patients with lupus have a blood pressure that's greater than normal, and normal blood pressure is 120 over 80. So again, 50% of people with lupus have a blood pressure that's considered to be hypertensive, 140 over 90. However, many more patients with lupus have blood pressures that are higher than normal. What's so devastating about high blood pressure is that it can affect all our organ systems. And although that there are several causes of individuals, or excuse me, there are several causes for individuals to have high blood pressure due to lupus, those with certain other sort of conditions are at increased risk. Those being obesity, having kidney disease, and long-term steroid use are some of the causes of high blood pressure in people with lupus. Other causes can be medications. So patients, especially lupus patients that may be taking anti-inflammatory medications, cyclosporine that can be a cause of high blood pressure. Again, high blood pressure can lead to kidney failure, stroke, or lack of blood flow to the brain. It can also lead to heart failure and ultimately having a heart attack. The key thing about heart attacks in women is that the typical signs and symptoms of having a heart attack aren't there. So that crushing chest pain on the left side of your chest typically does not occur in women. Women typically have what we call the atypical signs of a heart attack. Sometimes those signs are just shortness of breath. It could be difficulty breathing. Maybe they feel tired than normal. Those signs can be a sign of a heart attack. And oftentimes women kind of put those symptoms off because they just attribute it to overworking too hard or getting older. Sometimes women can have discomfort in their jaw or in their neck. All those are signs, could be signs of a heart attack. And so with those atypical signs, it's important to really maintain a blood pressure or understand what your blood pressure numbers are. Check your blood pressure. And if you're on blood pressure medications, stay compliant with those medications. Take those medications as directed by your doctor. But we'll end the talk today with some of those tips as to what individuals can do to really ensure that they have great heart health. So moving forward with some of the other things that lupus can do to the body and to the heart, another condition is called atherosclerosis, which is a big term to just say that there's hardening of the arteries. And what can happen is that as these arteries begin to harden, develop plaques and deposit within them, it can make it very difficult for blood flow to go in to move through those vessels. What can happen if blood flow can't move through those vessels? Well, again, patients are at risk for having a heart attack or having a stroke. Research has shown that being overweight and having high blood pressure are the two most important predictors of heart disease and lupus. Again, the risk of having a heart attack in women with lupus age 35 to 44 is 50 times greater than that of women without lupus, and everyone with lupus the risk is increased about 7 to 9-fold than those individuals without it. So again, lupus can affect our blood pressure, causing individuals to have higher blood pressure, and it also can cause hardening of the arteries. Now, if we think about the heart, we need to understand that within the heart sits in a sac, and that sac is called the pericardium. And it's that sac that within patients that have lupus can get inflamed, and that's called pericarditis. And pericarditis is oftentimes the most common heart problem associated with active lupus, and occurs in about 25% of patients with lupus. Again, this inflammation around the sac can lead to patients having chest pain, just a burning in their chest as the sac, the lining of that sac gets inflamed and swollen and produces a fluid around that heart. That fluid can affect the way that the heart beats because, again, that heart is in that sac, but now there's a lot of fluid in that closed sac that can affect the function. What can patients ultimately feel in addition to chest pain is fatigue, sometimes the feelings of a heart attack. And so that would lead individuals to go to their seek medical attention. And oftentimes the treatment for pericarditis or inflammation of that sac around the heart is a treatment with non-steroidal anti-inflammatory medications. So for that, oftentimes that treatment for pericarditis is really non-surgical by and large. Another condition that individuals with lupus can potentially affect or experience is, we talked about the lining or the sac around the heart, but within the heart there are heart valves. And these heart valves can also become inflamed. Again, lupus is an autoimmune disease that can cause inflammation and disease in a lot of different places. Within the heart itself, there are valves that keep blood flow in certain chambers or rooms within the heart. When these heart valves get inflamed, and they can develop what are called vegetations, and ultimately these vegetations lead to what's called endocarditis, or infection or inflammation of the heart valves. Sometimes what we see is that this form of endocarditis is associated with antiphospholipid antibodies, which is present in about 50% of patients with lupus. Endocarditis can lead to two major complications. They can lead to infection. So when these vegetations, this inflammation grow on the heart valves, bacteria that may get into our bloodstream from going to the dentist can infect those heart valves. And if those heart valves get infected, we hope that we can treat that infection with antibiotics. However, if it can't be treated with antibiotic, surgery would have to be undertaken to replace that heart valve. The other complication that can occur due to endocarditis is when those vegetations grow on that heart valve, the vegetations can spring off from the heart and go to the brain. That in and of itself can cause a stroke. So two of the major feared complications of endocarditis in patients with lupus is development of infection or having that, which may lead to patients having heart surgery. And the second one is causing a stroke. And the last condition that we're going to talk about is myocarditis, or inflammation. And so if you start to hear a theme as it relates to lupus in the heart, it's the itis. Pericarditis, inflammation of the sac around the heart. Endocarditis, inflammation of the heart valves within the heart. And then myocarditis, inflammation of the actual heart muscle. And this myocarditis, or inflammation of the myocardium or heart muscle, occurs in fewer than 10% of patients with lupus. So it doesn't happen that often, but again, the signs and symptoms of myocarditis mimic some of the others that we discussed before: having a heart attack, having a pericarditis. So you're going to have chest pain. It may have some shortness of breath, difficulty to kind of do some of those same activities that you used to do before. Maybe you get short of breath walking up 2 flights of stairs. So that myocarditis can also cause some of that inflammation of the heart muscle. And it can also weaken the heart's ability to do its job, and may lead to what we call heart failure if not treated appropriately. So what are some of the tips to really address our heart health? Well, first and foremost, do not smoke. As I recommend to all my patients, don't smoke, as smoking increases the risk of cardiovascular disease. So first and foremost, do not smoke. Second, nutrition. We are what we eat. So eating a low-fat, low-cholesterol diet is important. When patients ask me, "Doc, is there a particular sort of diet that I need to be on?" I recommend that patients eat the rainbow. When you have a plate of food, it should look like the rainbow: red, green, all the colors that you want. Oranges, it needs to look very colorful. And so I'm not too keen on prescribing a very specific sort of diet, but eating the rainbow. Try to limit your sodium or salt intake, as that can also lead to high blood pressure, or exacerbate high blood pressure, or make it worse. Eat whole grains. Try to, when you go to the grocery store, shop on the outside of the grocery store, because that's where the fresh foods are. That's where the produce is. That's where the things that have to be refrigerated is located. As you start to weave in the aisles of a grocery store, you're starting to see those things that are pro-inflammatory, that stuff that is high in high fructose corn syrup, the stuff that is processed. All those processed foods are within the aisles of the grocery store. And unfortunately, in our Western diet, that highly processed food leads to inflammation. And that pro-inflammatory state or highly inflammatory state can lead to some heart conditions such as atrial fibrillation or irregular heartbeat. And that too can lead patients to have strokes. The third tip is exercise. Getting 30 minutes of exercise a day is important. God has created our body with the great ability to create new routes of blood flow in situations in which arteries or blood that takes blood away from the heart can be blocked. And so to develop these, what's called collateralization or creating new routes of blood flow to bypass blocked arteries, what we recommend patients to do is exercise 30 minutes a day. And it should be as strenuous as someone can take. The fourth thing I recommend is see your physician. It's important to do your annual visit, see a physician as often as you should. I recommend patients at least to have an annual visit to make sure that their blood pressure is in good control, that their cholesterol is checked. And if your healthcare provider prescribes you medication, it's important that you take that medication. If for some reason you can't take that medication, it's important to communicate that with your provider, as there may be an alternative form of medication to take, or there's some other alternative treatment that may be good in lowering your blood pressure and or treating your overall health. So in conclusion, lupus affects a lot of organ systems within our body. It can affect the kidneys, it can affect the lungs, but the heart is of the utmost importance. Why? Because heart disease is the #1 killer of Americans. And as we discussed today, the various sort of forms in which lupus can affect the heart. It can cause high blood pressure. It can cause hardening of the arteries, atherosclerosis. It can also cause the itis of the heart. Pericarditis, inflammation of the sac around the heart, as well as myocarditis, inflammation of the heart muscle that can weaken the heart, and endocarditis, inflammation of the valves within the heart that can ultimately lead to patients having a stroke or potentially needing open heart surgery to replace those heart valves. Again, the tips to stay healthy, as we say, heart healthy, would be to not smoke, eat a good nutritional diet, eat the rainbow, not Skittles, but eat the rainbow, fruits and vegetables, shop on the outside aisles of the grocery store. Exercise 30 minutes a day, get your heart rate up. If it's been a while since you've exercised, make sure you talk to your physician before starting the strenuous exercise program. And see your physician, at least get your annual visit, make sure you screen for all sort of diseases at your respective ages. Getting your colonoscopy, getting all the screening tests for cancer and everything else like that. And the last is take medications as prescribed. And if you can't take a medication for whatever reason, or you're not taking a medication for whatever reason, communicate that to your healthcare team, as there may be alternatives that you can try to help treat those conditions. Thank you.
Hello, and thank you so much, Kelly and More Than Lupus, for your invitation to collaborate for this presentation. I'm Tatiana Spiegler. I'm a patient engagement liaison representing GSK. I'm a master's prepared nurse with 10 years of experience. And as a nurse, I was always surprised to hear lupus patients that were not prepared to care for their lupus and that they didn't know the basics of lupus or what they could do to make their lives better. And there's an even bigger need for education for people of color, as lupus affects this population at a higher rate. So I'm very honored to be in this role where I get to bring information and awareness about lupus to absolutely anyone that will listen to me. And hopefully today you can walk away from this presentation with at least one helpful tip that could help you feel more in control and help you manage your lupus. And remember, this presentation doesn't take the place of talking with your doctor. And today we'll be talking about lupus education and some things that you can do in the future, and like ways to track your symptoms and how to communicate with your healthcare team that can really help you manage your lupus. So let's start with the basics of lupus education. And this is a very quick review. And if you feel like you want to know more about this section of the presentation, you can join me and my team at gskplacehelp.com for our intro to lupus and lupus nephritis webinar that will give you a lot more information than these next few slides. So let's start with the fact that lupus is an autoimmune disease, meaning that your immune system attacks its own healthy tissues, and those attacks cause inflammation. The inflammation is perceived as pain, and if we don't control that inflammation, it can lead to damage. And that is what we perceived as the signs and symptoms of lupus. And these attacks can target absolutely any body part. The second thing to understand about lupus is that it's a chronic disease because it's a diagnosis that will last a lifetime. But there are treatments and lifestyle changes that you can do and adopt to help you control lupus activity in the body and prevent those complications. And when we talk about signs and symptoms of lupus, we also talk about flares and remissions because these are periods where your signs and symptoms are worse, meaning a flare, and also remission when are periods where you may feel better and your symptoms are not as bad. And that is when lupus is not that active in your body. Lupus can affect any body part from head to toe, and the signs and symptoms of lupus affects everyone differently. So we're not going to have two people with the same exact story or journey of lupus. And also lupus is always changing. So one day you may wake up with a rash in your skin, and the next day that rash may be gone, but now you have swollen joints. So it's very unpredictable. And it can also be very isolating to live with lupus if you don't learn how to manage it. And there are two types of signs of lupus activities in the body. And one of them is visible or physical, because you can just tell by looking at a person. And like I mentioned, a rash is a very typical sign of lupus that's very easy to see on somebody else. And the other ones are invisible signs of lupus. These are signs that are more dangerous because when lupus is attacking the body from the inside, and that is where we have our vital organs. So we have the brain, the kidneys, the lungs, and so on. And the connection that I want to make here is that symptoms reflect the activity of lupus in the body, and lupus can lead to organ damage. So if we track lupus symptoms, it can help your doctor identify if a treatment is working or if it's time to try something new to get those symptoms under control and prevent complications. And symptom tracking is key to learning how to manage your lupus. You should be doing it. You should be doing it even if you feel like you're in remission, just because it's very important to start tracking when those symptoms are coming back. And this is one way that you can get a larger view of how you're doing and to also become more engaged in your care. And we'll talk about tracking of the symptoms and also one method that you can use that's called health journaling. So keep track of every single symptom of lupus that affects your body, as it may be hard to recognize what symptoms are caused by lupus and what symptoms are caused by absolutely something else. So tracking involves monitoring your disease activity, and that involves learning to listen to your body. And remember that you're the expert when it comes to your own lupus. So once you've identified improvements or worsening of symptoms, you need to communicate those changes to your doctor. And this is what we call being proactive. So if you know that something is not right and you're reaching out to your doctor and not just waiting until the next appointment, because sometimes these appointments can take months or weeks for you to see your doctor. And that is the only way that you're going to be able to get in and get help to really reduce the long-term organ damage by getting those symptoms under control. And start considering the symptom and how long it lasts, when it occurs, and how severe it feels. Consider also how your symptoms are impacting your life, and a few examples from your day-to-day life can give your doctor a view of your experience with lupus, and it can put things into perspective. It's very different to say that you're noticing more fatigue from saying, like, I'm unable to get out of bed in the morning. It takes me 20, 30 minutes when it used to take me 5. I'm unable to stand up for longer than 10 minutes or whatever it is that change. And the last thing is to keep track in a way that works for you. And that could be a calendar, a health journal, an app, a notebook, anything that works, just keep doing it. And at the end of this presentation, I have a free resource that takes you to a symptom tracking tool that you can try, and maybe you can show your doctor next time you have an appointment. Now, health journaling is one way in which you can keep track of symptoms and a lot more. It's very comprehensive, it's very detailed, and it's your health experience. With lupus, there are a lot of things that you need to keep in mind and keep organized. In a health journal, you can take note of your disease journey, medications, dosages, lab tests, procedures, symptoms, triggers, emotions, and your own mental health. And through a health journal, you can track how symptoms are affecting your life, and it can also help you identify patterns and triggers so you learn to avoid them and how to prepare to prevent a flare. And keeping a journal is not just important to learn more about your own lupus. In several studies, writing about stress and emotions, also called expressive writing, has been proven to have clinical benefits for patients and autoimmune and inflammatory conditions like lupus. Writing can be healing. Making entries in a journal can help you stay organized. It can help you realize what your thoughts are, what your needs are, what your goals are. It can help reduce stress and manage uncertainties of lupus. And over time, your journal entries can help you show your doctor a more accurate picture of how lupus is affecting you in your day-to-day life. And with lupus, some of the changes are very gradual and slow and hard to identify until one day you realize that your lupus symptoms are making it very hard to do things that you used to do. So health journaling could really help you identify those changes sooner. And to get started with health journaling, I have a few easy steps. The first one is to find a journal form that works for you, and that could be written notes, notes on your phone, or any other device, whatever works for you. And, I know someone that has a really hard time typing, so they use the dictation feature on their computer, and they also rely on voice notes on their phone. So you can also consider drawings, photos, calendars, or anything else that can help you stress how you're feeling and what your journey is. The second thing is to set up your journal with your health story and the goals for your health. So when were you diagnosed, what has happened since your diagnosis, and also where you want to be when it comes to lupus. Then make your journal entries part of your routine. Find a time each day or each week that works for you. You can also consider starting very small, like doing a journal entry 3 times a week and then going from there. And you can also journal as often as you need to maintain an accurate record of your experience. And also take notes of whatever you may think it's important. Your journal entries can include signs and symptoms of lupus, like joint swelling, fever, rashes, or any other symptoms that you're experiencing. You can also track blood pressure, weight gain, energy levels. You can add on your emotional and mental symptoms and how you're feeling, including your quality of life and any brain fog that you may be experiencing. And you can also do symptom triggers that come in many forms, but if you take note, then you're able to avoid them and then prevent flares. And also think about how lupus is impacting your life and write out a couple of examples. And when you go to your doctor's appointment, you can share your journal with your doctor and your healthcare team. And you can use your journal to prioritize what questions to ask during your appointments. And you can also discuss with your doctor, make notes of what your doctor is recommending or what the next steps are in your care plan. And communication is a very critical part of staying engaged with your healthcare team and in your care. In this session, we have a couple of tips that you can practice to get you ready for your next appointment. So in your life with lupus, there are many people that are involved in your care, and that could include caregivers, doctors, nurses, technicians, therapists, and the list can keep going. And with each of these people, open and honest communication is important for those relationships, and it can also help you in other areas of your life, like physical, mentally, and emotionally, because you're creating those connections. And as you communicate with your doctor, there may be a few challenges that you face. Appointments can be very short, and you may feel like it's a time crunch when you're seeing your doctor and you're trying to fit in weeks or months of concerns into those 15 minutes. You may also find your doctor using words that you don't recognize. And lastly, you may feel afraid or embarrassed to share certain symptoms or conditions that you're experiencing, and you might be less likely to share those with your doctor. So make sure that you have a way to communicate with your doctor's office if you, or maybe develop a plan for when you feel like a flare is coming up. So you don't have to wait months until your next appointment, and you can actually get help and control those symptoms. And in the next slide, I have a few tips that can help you communicate with your healthcare team a little better. So before your appointment, so this is preparing you for your appointment, you should, and if that's a few weeks or a few months away, you should start tracking your symptoms if you're not already doing so, and make sure that you're adding the latest details of your experience. Also think about how those symptoms are impacting your life and try to write down a few examples, like I'm having to miss out on family events, or I have a hard time staying active because of fatigue. A few examples can give your doctors a good view into your life to lupus and what you're struggling with. Think about your goals and expectations for the appointment. Do you want to leave the appointment feeling like you have better ideas on how to manage your lupus, or perhaps you're looking for a change in your treatment plan because what's going on with your lupus, it's not helping you achieve those goals? And be sure to list any questions or concerns that you may want to bring up while you're with your doctor. Sometimes it's really hard to remember everything you want to talk about, and that's where an appointment buddy can also be helpful. A close friend or caregiver or family member can come with you to your appointment and help you remember your questions that you want to make, and also take notes of the doctor's suggestions. And if your buddy can't come to the office with you, you can call them before or after, and then they can help you with your notes. And the last thing is to try to practice what you want to say at the appointment. And this may feel silly when you're, just getting used to this, but it can really help you make the most when you're having those 15 minutes with your doctor, especially if you feel like you're rushed during that appointment. This tip is so helpful because when it's your time to talk, you're going to be ready. And these tips are for during your appointment. So have your medications with dosages and what they're for, and also your journal handy with you so you can show your doctor. And be an active listening, so listen to really understand, repeat key points, and clarify anything that you don't understand. Remember, you can always ask questions, and some of the questions can be used to start a conversation, like, what do my symptoms tell you? Or what are my treatment options? You can also ask about side effects and what you should be aware of, so you're prepared when you go home. And the last thing is, while you're with your doctor, consider if you want to ask about a specialist or seek a second opinion. And this may feel like you're being rude or disrespectful to your doctor, but most healthcare providers are very comfortable giving recommendations and referrals. And in this slide, we see a typical healthcare team of someone with a lupus diagnosis, and yours may look very similar, or maybe it looks very different. You may have more doctors or less doctors. And this is just to give you an idea of how many practitioners could be prescribing medications for one person. And each practitioner, if they're not communicating or they're not being looped in to your care plan, may be creating different goals and have a very different plan of what your goals are. And it's very important to keep everyone on the single plan, so that way you can achieve your goals, and then everyone on the single page, on the same page, so that way you're not being pulled and having contradicting care plans. So take a moment to think about your own doctors and specialists who have prescribed medicines for you, and how they are all in communication, or how are you communicating with them about what the other ones are doing. So this is called coordination of your treatment plan. And it's really important that each doctor knows the challenges that you're facing and the goals that you have for your own treatment. For example, if you have lupus symptoms on your skin and you have a dermatologist appointment and they prescribe a new medication, all the other doctors should also know about this medication that you've started. And this may be the one task, and you may be the one with this one task and responsibility of communicating and coordinating all of these doctors, but you can also designate a caregiver that can help you with this coordination, or maybe your primary care physician or your rheumatologist, so that way your whole healthcare team is in the same plan, and you can delegate to your team captain. And here we have some resources for you. All our resources are free, and the one that I recommend the most is the symptom tracking QR code. If you don't know how to use these QR codes, you get your phone, like you're going to take a picture and you just hover it over the code that you want to scan. A link will come up that will take you to a website with the resource, and then you can sign up with all these resources. You can also join us at Us in Lupus Facebook page. It's a community of lupus warriors, and you can come see our monthly webinars at gskplayshome.com. And I'll give Kelly the website so she can share it with you guys. And this is how we're going to end this presentation today. So I hope that at least one of these tips is helpful for you in the management of your lupus. Thank you.
Hi, everyone. So by now you've heard Dr. Stephen Noble share his expertise on how lupus can affect the cardiovascular system, signs and symptoms, and things that you can do to be proactive, particularly if you're a person of color living with lupus who has heart involvement. Then you heard from Tatiana Spiegler, GSK Patient Engagement Liaison, about lupus in general and how you can improve doctor-patient communication by journaling, by symptom tracking, and by rehearsing what you're going to say before you enter your doctor's appointments. And now it's my pleasure to bring Anita Nobelov back here to share her patient experience. The one thing that we pride ourselves on at More Than Lupus is allowing the patient's voice to be amplified. So that being said, Anita, thank you so much for joining us in this conversation again.
Thank you, Kelly, for having me. As you know, I'm a board member of More Than Lupus, which you invited me to join the board, which I'm honored to be on. And I want our audience to know that this is the second Oregon Lupus board that I've been a member of, and I've enjoyed my tenure with More Than Lupus very much. Being a board member of More Than Lupus, it has allowed me to not only effectively advocate better for myself, but to advocate for our fellow support members. And I consider it an honor when asked by a patient if I would attend a doctor appointment with them, because, you know, as Kelly knows, sometimes when we go to our doctor appointments, we sometimes can't find the words to say to the physician, and we need somebody to speak on our behalf. And throughout my 30 plus years with lupus, I have had other people go with me to some of my doctor appointments when I've just been in tears and can't express myself. I was first diagnosed with lupus by a dermatologist. I was diagnosed with discoid lupus, and I recall, and that was in Indianapolis, Indiana. I recall asking him, what are the chances of this turning into systemic lupus? And he said, oh, about 50-50. And eventually, yeah, it did. It became systemic lupus. For me, the organ that is affected are my lungs. So I have inflammation in my lungs. Therefore, I have a pulmonologist as one of my regular doctors. It wasn't easy, as I'm sure this has happened to others out there, to be diagnosed. Most of you know it takes several years, on average 5 to 7 years, to finally get the correct diagnosis. But in my experience, I had, a physician, when I was explaining to him how my body felt, he literally asked me, how was my marriage? And I sat there and thought to myself, what does my marriage have to do with the pain I'm feeling? And I shared with him that my marriage was just fine. My exact words were, my body hurts like hell, and it has nothing to do with my marriage. And eventually, I left the state of Indiana. I now live in Portland, Oregon, and finally got the diagnosis I needed and am being treated, I feel, pretty successfully with my rheumatologist. As all of you know, it's like Dr. Stephen explained, it's the body is attacking itself. And some mornings, some days are good, and then there are days where you just can't, get yourself out of the bed. The thing I want to say to all of you out there is don't be too hard on yourself. Take care of yourself. Pace yourself, because it is peaks and valleys. You're going to have good days, but we have a saying here at More Than Lupus. We have lupus, but lupus does not have us. And that's the model, we try to live by.
Anita, thank you for sharing a glimpse into your story. I know that is just a few minutes of a journey with many ups and downs over the last 30 years of living with discoid and then systemic lupus. And I know you're usually the one asking the questions when we do events, so I appreciate you being put on the spotlight there. Now, you mentioned what that doctor said to you when you were trying to get down to the bottom of your symptoms and you knew something wasn't right. And unfortunately, in communities of color, medical gaslighting happens in much larger numbers. And medical gaslighting is when a healthcare professional downplays or blows off symptoms and tries to convince a patient that the issues are caused by something else, like your marriage, or even that it's your time of the month, or it's imaginary, you're hysterical, you're attention seeking, all of those things. Anyone is susceptible to this happening, but it's more common in communities of color, unfortunately. So how long did it take you to get diagnosed from symptom onset to when you got that diagnosis?
I would say it took 6 years, Kelly, from, being diagnosed with discoid. I recall him saying, that I needed to start wearing hats and sunscreen. And, there is something about the African American community that, we just don't necessarily buy into sunscreen, which is something that no longer exists in the community. We know that sunscreen is vital and necessary. And I'm sure, like others out there, we love the sun. And when I was told to wear a hat, I just like, oh no, that means I can't get the full enjoyment of the sun. And so, yeah, I would say it took 6 years before I found someone who, ran all the proper tests to tell me, yes, you have systemic lupus.
And by that time, I know that lupus affects many different parts, your body, but particularly your lungs. By that time, was there lung involvement and other things that unfortunately were not addressed?
I would say, once the first thing that was addressed, were my lungs. And today at age 69, I have the inflammation in my joints. I have osteoarthritis in the left hand and rheumatoid arthritis. I had a knee replacement around 2 years ago. And as most of you know, we deal with dry mouth. And I would just say to that, seeing a dentist, if you have lupus, is crucial. Because it's amazing, because lupus is now discussed more than it was, 30 years ago. There are physicians who are more knowledgeable about some of the side effects of having lupus, like dry mouth.
So for those that are watching today, or maybe are trying to get to the bottom of a diagnosis, or even trying to make the most of their doctor's appointments. Are things that you would suggest to being proactive to improve doctor-patient relationship and communication, maybe even being proactive to avoid being dismissed or mistreated even in a doctor's office? Any pointers or tips that in your experience have been helpful?
Well, with what I know now, I wish I had been told to be more prepared for my meeting with my physician. I would have come to the visit with notes in hand, because relying on one's memory is not always the most effective, because you naturally, that patient-doctor relationship, it's natural to feel intimidated, first of all, by the white coat. This person's superior. This person knows more than me. So it's easy to become intimidated, and then you become frustrated. Therefore, you haven't had a positive experience and shared what you think about when you're at home. And I'm going to say this, I'm going to say that. But I would say to someone, make sure you have notes. And if you know you have an appointment coming up, start recording, jotting down what it is you're feeling. It took me forever before I started keeping like a lupus diary and notes of my symptoms. And so that's what I would say to somebody is take notes, make a note about your symptoms that you're experiencing, and even what time of day and what joint was bothering you. I would say that to a fellow lupus patient.
That is such great advice. Make your moans measurable so they can check it, right?
Right.
Thank you so much for sharing your insights with us, and thankful for the work that you do here at More Than Lupus, and for facilitating the support groups and every way that you contribute to lupus advocacy and support. And look forward to having you on again with us.
Well, as you know, Kelly, I love what I do, and you make it so easy and so much fun. And I've shared with the group. I think I'll be 70 in June, and I've told you and other members of the group, I consider myself, your guys' den mother. And so I feel like you're all my children. And so I love that role. I'm not as knowledgeable as you are, Kelly, but I love being the mama of the group.
Well, I know I consider you one of my mentors, and I appreciate you so much. And I would gladly take that role as Mama Den. I love it so much. Thank you again, Anita.
Thank you, Kelly.
We'll see you next time.
All right.